Okay, so moving on. All right, so let's take a look at some key statistics now. Okay, so sepsis is a global health crisis with 47 to 50 million cases per year and 11 million deaths. Okay, so that's one death every 2.8 seconds. 1 in every 5 deaths worldwide is also associated with sepsis, with the risk of dying increasing by 8% for every hour treatment is delayed. Okay, so sepsis also disproportionately affects the vulnerable populations, with 85% of cases occurring amongst newborns, pregnant women, and people living in low-resource settings. Okay, and for pediatrics in 2017, almost half of all global sepsis cases occurred amongst children, with an estimated 20 under 5. Okay, so AMR or antimicrobial resistance is a major challenge when it comes to sepsis treatment, as it complicates the ability to actually treat the infections, especially in healthcare-associated infections, where you would find all of your very, very resistant superbugs. Okay, so that's a bit on the statistics for sepsis. All right, so moving on, let's take a look at some basics of blood cultures. Okay, so a successful blood culture is defined by two main factors. Okay, so the first factor I have here is a clinical-based factor, which involves all of those actually taking the blood cultures, which looks at the maximum number of significant positive cultures. And the second factor is a more lab-based factor, which looks at the earliest time to detection of positive results. Okay, so what factors impact culture sensitivity and time to results? Again, I've got two factors here. The first one, the clinical-based factor, is blood collection method. Okay, so this one, you've got the skin disinfection step, volume, timing, as well as any delay in the culture itself. And the second factor, again, a more lab-based factor, which looks at the growth of organisms. Okay, so this one looks at the function of organism growth properties, as well as the presence of antibiotics in a sample. Okay, so I'll explain to you later as to why that's an issue when there's antibiotics in a sample when it comes to blood culture testing. Okay, so what are the most common reasons for a negative blood culture? Okay, let's say you get a negative result and you feel that it's a false negative result, or it doesn't correlate with the patient's clinical picture. Okay, so the first factor is insufficient blood volumes collected, and the second one, patient on antibiotics. And again, I'll be covering these two factors throughout my presentation. Okay, so let me just give you a quick overview on the technology behind the BACTEC system. Okay, so what actually happens is that when you first fill up the blood culture bottles with the patient's blood, okay, so containing the organism, that organism undergoes metabolic activity in the bottle, thereby releasing carbon dioxide. Okay, so the carbon dioxide in the bottle then reacts with the dye in the vial sensor. All right, so if you're familiar with the blood culture bottles, you would notice that at the base of the bottle, there's a chocolate-colored coating. Okay, so that's what we call the vial sensor. All right, so when you then take that bottle and you put it into the machine, an LED will activate the fluorescent material in that sensor, and a photo detector then reads the analyze for positivity. Okay, and positive results are announced via an audible alarm on the machine, as well as a red light will come on. So a red light will indicate that there's a positive vial, and then as well as on-screen indications on the PC system. Okay, sorry, let me just mute. Okay. Okay, so that's a bit on the technology behind the BACTEC system. Okay, so, all right, so next, let's go to the key features of the blood culture bottles. Okay, so the first bottle I have here is the aerobic bottle. Okay, so this aerobic bottle is for the aerobic culture and recovery of organisms from the blood. Okay, so this bottle contains a media that's called the resin media. for antibiotic neutralization. Okay, so if you are familiar with the bottle, again, if you notice inside this bottle, there are little tiny beads. Okay, so those beads is what we call the resin media. All right, so one very important thing that I would like everyone to take note with these next few slides is the optimal volume of the bottles. Okay, because volume is the single most important variable when it comes to maximizing the test sensitivity. Okay, so for the aerobic bottle, the optimal volume is 8 to 10 mils. Okay, so the anaerobic bottle, this is the anaerobic bottle, is for the anaerobic culture and recovery of anaerobes from the blood. Okay, so it's a bit different from the aerobic bottle because it does not contain the resin media. Instead, it's got a lytic agent called saponin inside it. Okay, so in terms of optimal volume, it's the same at 8 to 10 mils. Okay, so the third bottle I have here is the pediatric bottle. Okay, so this bottle is for specifically for the pediatric patients. Okay, so for all routine peds culture, you just need to use this one single bottle. Okay, so this is actually an aerobic bottle. All right, it's designed for the recovery of aerobes from the blood. Okay, so it contains a resin media, same as the adult version. Okay, but it contains a lower anticoagulant inside it. Okay, so that's why it's able to receive less blood. To actually, volume of this bottle is 1 to 3 mils, but it has a range of between 0.5 to 5 mils. Okay, and I'll discuss with you later as to how you can estimate the amount that's needed for a certain peds culture. All right, so the last bottle I have here is the mycoathletic bottle. Okay, so this bottle is for the recovery of mycobacteria, yeast, and fungi from the blood. Okay, so they all have slightly different incubation periods, as you can see here. For yeast, it's 7 days, fungi 30 days, and mycobacteria 42 days. Okay, it also depends on the lab as well as the hospital as to how long they usually incubate for these different organisms. Okay, but the numbers I have here is as per our product insert. It's 1 to 5 mils. Okay, so just a bit more on the resin media that you would find inside the aerobic bottle as well as the peds bottle. Okay, so what it is designed to do is to quickly and effectively neutralize antibiotics in a sample. Okay, because what the antibiotics would do is that they would inhibit the bacteria and fungi in blood cultures. Okay, so by doing that, it makes it virtually impossible for us to capture what organism is responsible in that particular case. Okay, so besides that, the resin media also provides the organisms with growth centers to enhance the speed and recovery rates, whilst also helping to break small blood clumps inside the bottle, as well as to lyse the blood cells. All right, so the benefit of this, it would be to provide decreased time to detection, meaning that you would get a faster positive result. Okay, so when you get a faster positive result, it will in turn decrease the length of hospital stay as well as patient costs. Okay, so for the anaerobic bottle, instead of the resin media, you would find a lytic agent called saponin inside it. Okay, so what saponin does is that it lyses the blood cells, thereby releasing intracellular microorganisms as well as growth factors. Okay, and the benefit will also be faster positive results for both and recovery of both anaerobic and facultative anaerobic bacteria. Okay, so that's a bit on the key features of the bottles. Let's now get into the main chapter for today, which is factors contributing to clinically effective blood cultures. Okay, so I've got 6 main factors here, which I'll be covering one by one, starting off with disinfection, moving on to disinfecting agents, site of collection, timing, volume, and collection of multiple sets. All right, so let's start off with the first factor, which is disinfection. Okay, so even before starting your blood culture taking process, you need to first inspect the blood culture bottles for any signs of damage, leakage, or contamination. Okay, so to know if there's any contamination inside the bottle, you may check the fluid inside the bottle and make sure that it's clear and not cloudy or murky, as well as there are no presence of any precipitates inside the bottle. All right, so please check the expiry date and make sure to never use expired bottles, okay, because results from expired bottles cannot be verified by us, basically. All right, so the second step that you need to do is to mark a 10 ml fill line above the level of the fluid inside the bottle. Okay, so on the side of the label here, okay, so this step will be clearer once you watch the video at the end. Okay, so yeah, so for all bottles at the side of the label here, there are increments of 5 ml. Okay, so what you need to do is that identify the level of the fluid inside the bottle and mark a 10 ml fill line above it. Okay, so this would actually ensure that you are capturing the right amount. Okay, so when you're filling up the bottle, the level basically needs to rise up till here. Okay, so next, you need to pop the plastic caps off and disinfect the top of the septum cap with an alcohol swab. All right, so please use 1 alcohol swab per bottle. Okay, so next, moving on to the skin cleansing step. Okay, so according to CLSI guidelines, you would first need to start off with an alcohol swab and then followed by your agent of choice. Okay, so chlorhexidine and povidone iodine are two very commonly used disinfectants. Okay, so for chlorhexidine, it has a very quick drying time of 30 seconds. However, povidone iodine needs a full 2 minutes for it to dry to achieve its effect. Okay, so for pediatric cases below 2 months of age, please just use the alcohol swab and not chlorhexidine because it hasn't been proven to be safe for use in those below 2 months of age. Okay, for fear of skin burns and so on. Okay, so if you want better cleansing for patients below 2 months of age, you may actually do multiple applications of the alcohol swab. One second, let me just mute all. Okay, so sorry about that. All right, so after cleaning the skin, you would then proceed to get your samples via standard venipuncture techniques. Okay, so next, which bottle to inoculate first? Okay, so once you've taken the blood, if you're using the needle and syringe method, you would first need to fill up the anaerobic bottle first, followed by the aerobic bottle. Okay, so the reason for this is when you have a syringe that's filled with blood, right? So the air is actually above the level of the blood. Okay, so we want to prevent that air that's above the level of the blood from ending up inside this bottle, the anaerobic bottle, because the anaerobic bottle has got no oxygen to cater for the obligate anaerobes. Okay, so that's why you need to fill up this bottle first, followed by the aerobic bottle. All right, so if you're using the winged blood collection set, meaning the butterfly needle with the tubing and the needle holder, okay, so it goes straight from the patient's arm into the bottle. All right, so you would first need to fill up the aerobic bottle first. All right, so the reason for this is when the blood flows from the vein into the needle and into the tubing, it will be pushing the air that's inside the tube to end up inside the aerobic bottle, and that's fine. And follow that with your anaerobic bottle. Okay, so if you forget which and where we want to prevent that air from ending up inside, okay, which is this purple or anaerobic bottle. Okay, so when it comes to labeling of your bottles, there are 2 areas which should never be covered with the patient sticker. All right, so the first one is the barcode, because the barcode needs to be scanned by the machine. And the second place is the base of the bottle, where you would find your vial sensor. Okay, so these 2 areas should never be covered with the patient sticker, or else your sample cannot be processed. All right, so blood culture samples should ideally be sent to the lab promptly within about 2 hours of collecting the samples. Okay, because the faster they incubate the samples, the faster you would get your results. Okay, so when it comes to storage of the bottle, bottles, please store all bottles, whether used or unused, at room temperature. Okay, so do not refrigerate them or incubate them outside of the lab. All right, so when it comes to transporting of the samples, please place them in a biohazard bag for safety. All right, so with regards to the order of draw, all right, so let's say you've got a whole list of bloods that needs to be taken for a certain patient, then you would take your blood culture samples aseptically, and upon getting the blood, fill up the blood culture bottles first. Okay, so after filling up the blood culture bottles, please invert the bottles gently a few times to prevent blood from clotting inside it. All right, so after filling up your blood culture bottles, and then move on and fill up all of your other test tubes in the order that you can see on the diagram. All right, so let's move on to the second factor, which is disinfecting agents, iodine versus chlorhexidine. Okay, so chlorhexidine is a lot more superior than povidone iodine when it comes to blood cultures. Okay, so the reason for this is that certain blood, serum, and protein-rich biomaterials can actually deactivate the microbiocidal effect of povidone iodine, but not of chlorhexidine. Okay, chlorhexidine also has a residual or long-term antimicrobial suppressive activity, which is prolonged at about 6 hours. And it does help to reduce the colony count of cons, a very common skin contaminant. All right, so if possible, please make sure to choose chlorhexidine over povidone iodine when it comes to blood cultures. Okay, so moving on to the third factor, let's take a look at the site of collection. All right, so peripheral versus line draw. Okay, so it's a rule of thumb that blood cultures should never be taken from any existing line, okay, because there's a high chance of getting contaminated samples when it's taken from any existing lines. Okay, so you need to get your blood culture samples through a fresh venipuncture peripherally. Okay, so let's say you're dealing with cases of CRBSI or catheter-related bloodstream infections, then take one set of blood cultures from that suspected line and another one from the periphery. Okay, so you need the one from the peripheries to actually basically interpret your results to know where the source of infection is coming from. All right, so moving on to the fourth factor, timing. So when to actually take blood cultures. All right, so blood cultures should ideally be taken before any antibiotics are administered. Okay, so even in ED, before giving that bolus of antibiotics, please make sure to get your blood culture samples first. Okay, because as I mentioned just now previously, what the antibiotics will do is that it would inhibit bacteria and fungi in blood cultures. Okay, so even with the resin media in place, there's no agent that's completely 100% at removing all traces of antibiotics. Okay, so it's always better to get your samples before any antibiotics are administered. Okay, so the second time when you need to culture or reculture a patient in the ward, for example, is when you are escalating or upgrading antibiotics. Okay, at any time you are doing that, please make sure to get your blood culture samples first and then proceed to escalate or upgrade the antibiotics. All right, so when you are downgrading antibiotics, however, you do not need to reculture the patient. Yeah, also only when you are escalating. Okay, so the third time, which is a very common practice, is to take your samples, your blood culture samples, during that exact time of a temperature spike. Okay, according to CLSI guidelines, however, there is no need for that, because experimental data show that an influx of bacteria into the bloodstream is followed by a lag of about 1 hour before the chills and fever develop. Okay, so therefore, there were no significant differences in positivity rates of blood cultures obtained in relation to the fever spikes of patients. Okay, so what I'm presenting today, however, is straight from the guidelines. All right, so please still follow the SOP of your hospital or your ward, as well as your specialist's instructions. Okay, so next, let's take a look at timing for blood culture sets. Okay, so when I mention sets here, is as per CLSI guidelines, which state that for all routine blood cultures, you need to take at least 2 sets from 2 different sites. All right, so the timing for your routine blood culture sets would be simultaneous or one after the other. There is no need for a time interval between collecting two routine blood culture sets. All right, so you only need a time interval when you're dealing with cases of infective endocarditis or IE, as well as some other endovascular infections. All right, so let's take a look at the guidelines for infective endocarditis blood cultures. All right, so the use of optimal techniques would usually yield positive blood cultures in over 90% of IE cases. All right, so it's always important to get your samples immediately to avoid any unnecessary delays in treatment, as well as getting your samples before giving that empirical antimicrobial blood cultures for IE. It can basically be obtained at any time. This is due to the continuous nature of bacteremia associated with IE. All right, so again, there is no need to wait for that exact time of a temperature spike to get the samples. Okay, so blood culture sets should be taken at 30-minute intervals between the samples. Okay, so as for the number of samples that you would need, the number would be 3 blood culture sets initially. All right, so if those sets are negative at 24 hours, then take another 2 more sets. So the total would be 5 sets overall. Okay, so when they mentioned 3 blood culture sets initially, yeah, so it's 3 blood culture sets from 3 different sites. All right, so it's not one very big syringe straw and you're filling up, multiple bottles, like 6 different bottles. All right, so it's 3 sets from 3 different sites. So it's 3 completely separate blood culture taking procedures. Okay, so let's move on to the 5th factor, which is volume of collection. Okay, so the volume of blood that you're putting to the bottle is the single most important variable when it comes to maximizing the test sensitivity. Okay, so let's first take a look at diagnosis of BSI in adults. Okay, so what this study did was they compared when smaller blood volumes were taken versus larger volumes. Okay, so when smaller blood volumes were taken, let me first quickly explain what the symbols mean. Right, so you've got the line that goes up and down like mountains, which represents the bacterial load in the human body, which fluctuates but never reaches 0. Okay, so you've got the plus and minus boxes above, which represents whether a sample came back as positive or negative. And then you've got the dotted line going across, which represents the detection limit. Okay, so when smaller blood volumes were taken in diagram A, all right, so what they found was that they were getting a few cases in between as being falsely negative. Okay, so when the sample was taken, when the bacterial load was lower, all right, so that set came back as negative. However, in diagram B, when larger or optimal blood volumes were taken, all right, so all samples came back as positive regardless of when it was taken. Okay, so whether the bacterial load was high or low, all samples came back as positive. Okay, so that's why it's very important to get the right amount when it comes to blood cultures. Okay, so and just to revise, for the adult bottles, the optimal volume is 8 to 10 mils. Okay, so for pediatrics, it's a bit different. So we cannot give you an exact number for each and every child. Okay, so of the different body weights and so on, right? So a rule that you can use as per CLSI to know how much blood needs to be cultured for a certain PEDS case is to not exceed 1% of their total blood volume. Okay, so and again, to recap, for the pediatric bottle, it's got a range of between 0.5 to 5 mils with an optimal blood volume range of 1 to 3 mils. Okay, because more or less really does matter. Sometimes people think that when you overfill the blood culture bottles, it's actually okay, but it's not, because overfilling causes false positivity and underfilling might cause false negativity. All right, so it's always important to stay within the right amount and of course, ideally within the optimal blood volume range. Okay, so we have come to the last factor, which is collection of multiple sets. Okay, so as per the guidelines, okay, so you need to get at least 2 sets of blood cultures from 2 different sites for all routine cases. Okay, so the importance of that is that it does help to increase the yield and sensitivity of the test overall. And it does help to determine the significance of isolation of contaminant organisms. Okay, because it has been demonstrated that positive blood cultures due to skin contaminants usually result in a single positive blood culture set when multiple sets were obtained. Okay, therefore, the multiple sets would actually help a clinician to distinguish between a false positive result due to skin contaminants from a true positive result. Okay, so what I have here is table A and table B. Okay, so table A looks at the number of blood culture sets performed versus the number that came back as positive, looking at the clinical significance of the isolates. All right, so when only one set was performed and that one set came back as positive, okay, so the significance of your result was nil as compared to when 3 sets were performed and either 2 or 3 sets came back as positive. Okay, so that way you're actually able to eliminate the contaminant portion of it, thereby proving the significance of your result. Okay, so table B looks at the number of blood culture sets required to detect common microorganisms causing bacteremia. With only one set, the numbers were a lot lower as compared to 2 to 3 sets as per the guidelines. All right, so this paper here, the Surviving Sepsis Campaign of 2016, states that for all appropriate routine cultures, always include at least 2 sets of blood cultures. All right, so that's 1 aerobic and 1 anaerobic bottle from the right arm, for example, and the same thing from the left arm. All right, so it's 2 separate blood culture taking procedures. Okay, so before I summarize, let me just quickly go through the concept of the perfect pair. Okay, so the perfect pair is a name given for a single set of blood cultures containing the aerobic bottle along with the anaerobic bottle. Okay, so you've got the aerobic bottle, which has the resin media to help neutralize antibiotics, and the anaerobic bottle, which has the lytic agent called saponin, which helps to lyse the blood cells, thereby releasing intracellular microorganisms. All right, so when used together, they help provide less time to MRSA detection, as well as less time to MSSA detection. Okay, so let me summarize my talk before letting you guys watch the blood culture taking video. Okay, so the perfect pair is a name given for a single set of blood cultures, which has the aerobic as well as the anaerobic bottles. Okay, so for skin antisepsis, always start off with an alcohol swab followed by your agent of choice. Okay, chlorhexidine dries very quickly at 30 seconds. All right, povidone iodine 2 minutes. And for PITS cases below 2 months of age, just use the alcohol swab and you can do multiple applications of the alcohol swab. All right, so the optimal volumes of the bottles will be 8 to 10 mils for the aerobic and anaerobic bottles. All right, so for the pediatric bottle, it's got a range of between 0.5 to 5 mils, and the microathletic bottle has got an optimal volume range of 1 to 5 mils. All right, so the site of collection for blood cultures would be only from fresh peripheral venipunctures. Okay, so never take blood cultures from any existing line. All right, so unless you're dealing with cases of CRBSI, then take 1 set from that suspected line and another set from the periphery. Okay, so the number of blood culture sets as per the guidelines will be 2 sets from 2 different sites. And the correct sequence for inoculation of the blood culture bottles. All right, so if you're using the needle and syringe method, fill up the anaerobic bottle first. And if you're using the winged blood collection set, then fill up the aerobic bottle first. Okay, so now let me play the blood culture video for you guys. Okay, so, and then we can do a Q&A at the end. Sorry, I would just like to check.
No
You
sound.
guys can hear the video, right? Oh, there's no sound.
I can't.
1 second. Let me just reshare.
I think on top of Dr. Nabil's point there, I would like to also emphasize that on top of focusing on the number of set, you should also pay a little bit more attention to the volume that you put in a bottle. Meaning, if you send a 2 set, but only you put 2 mils per bottle, it's still the yield might be lesser if you can give us one bottle that have a 10 cc blend. Okay, do you understand what I mean?
Yes, that's very true, Doctor. It's very important rather than sending multiple sets, you need to concentrate on that one set that you're sending to make sure that you give an optimal volume in that particular set, rather than sending multiple sets with suboptimal volumes.
Yes, because the detection is per vial, not per cumulative of the number of bottle that is being sent, right?
That's
current understanding is that once they send a higher number of sets with lots more of blood being sent, meaning they have a higher chance of getting the blood culture positive. But that's not the way. Okay? So I hope everyone get that point.
okay. So I'm going to try the video again.
All right.
Is there any sound from your end?
Still no sound.
Still no sound. Hold on. Let me just
or should we just watch the video?
Yeah. I think you know what, because the video has got subtitles, so we can just watch the video and I can just talk through certain important areas.
Yeah.
Okay, so this is the blood culture taking video. Okay, so you would start off in the procedure room and clean the blood culture taking trolley first, all right? So using the alcohol wipes that you would find inside at your ward. Okay, so this is to prevent cross-contamination between patients. All right, so only then you would need to gather all the materials that's necessary. Okay, so don't forget your sharps bin at the bottom, as well as your waste bin. Okay, so then you would inspect the blood culture bottles for signs of damage, leakage, and contamination. Okay, so the expiry date is very important. Okay, so all optimal volumes are labeled in red on the bottles. Okay, so this is the step that we talked about. Okay, so to mark a 10 ml fill line on the bottle to help you know when you have achieved the right amount. Okay, so you would then approach the patient, introduce yourself, and obtain consent. All right, so explain the procedure that you're going to do, as well as verify that the name tag. Okay, so verbally as well as the bottle labels match. Okay, so next you would perform hand hygiene. Okay, so in between all your samples. Okay, so you would remove the blood culture bottle caps, disinfect the top with an alcohol swab. Okay, so when opening up the sterile set, it's important to use the forceps that you will find on the outside. Okay, so this is to prevent any contamination of the set. Okay, so and this is the way that you would need to open the set, never cross the sterile field. Okay, so this is to minimize movement or introduction of any contaminants into your set. Okay, so this is how you need to open the set from side to side. Okay, so when pouring the chlorhexidine solution, be mindful to not let it drip down the side of the bottle into your set. Okay, so because that would contaminate your set basically. And when opening up the items, please make sure to drop them gently and not, very aggressively or into the middle of the set. Okay, so needles, syringe, as well as your sterile gloves. Okay, and again, hand hygiene before all steps. All right, so this is the time when you need to identify the site. All right, so choose your veins. Okay, so now you would put on your sterile gloves. Okay, so assemble the needle and syringe, as well as prepare the chlorhexidine soaked cotton balls so that it's not too wet and not too dry, and it's just nice for you to clean the skin. Okay, so place the waste bin by the patient. All right, so now you would take both forceps, hold one in each hand, and you would need to pass the cotton balls from the clean hand to the dirty hand. Okay, so the dirty hand is the one that will be doing the cleaning. Okay, so you need to maintain this sequence to prevent contamination of your sterile dressing set. Okay, so you need to allow it to air dry. Do not fan it or do anything mechanical over your area that you have swabbed. Okay, so now you would drape the patient and you can proceed to collect your blood sample. Okay, so loosen or remove the tourniquet before pulling out the needle and apply digital pressure. All right, so at the side, and do not ask the patient to lift their arm too quickly. Okay, so for needle and syringe, fill up the anaerobic bottle first, followed by aerobic. And for the winged blood collection set, you would fill up the aerobic bottle first, followed by the anaerobic bottle. Okay, so this is the order of draw. All right, so fill up the aerobic bottle, the blood culture bottles first. Okay, so after you're finished, discard all of the items, put the sharps into the sharps bin. And just now you need to invert the bottles gently a few times, to prevent blood from clotting inside the bottle. Okay, so now you would get rid of all of your used items, and when labeling the bottles, never cover the barcode as well as the base of the bottle. All right, so next you would place the bottles in a biohazard bag for safety. Okay, include any forms that's necessary as well. Okay, so that's the blood culture taking video. All right, so just to inform you, before I forget, usually what I would do is that I would give a booklet that contains most of the information that I presented today. All right, because we are at the stage of converting the booklet from a hard copy booklet to an e-booklet. Okay, so we are almost done with finalizing the e-booklet. So I apologize for the delay. All right, so once I'm done with that, I will send over a link for the booklet to your hospital. Okay, so all right, so are there any questions?
Okay, anybody question from the audience? We have question in the chat box. I think I take one or two question.
Okay.
The first one, is it compulsory to take 10 ml blood per bottle?
Okay, so it is compulsory to take the optimal blood volume. So it's between 8 to 10 mils. Okay, so that would be the ideal amount that you will need to take for your samples. So yeah, so it's between 8 to 10 mils.
So another question, basically this question is from me. In
Okay.
situation where we are only able to withdraw blood just enough to fill in one blood culture vial, which
Okay.
vial should we prioritize first?
All right, so according to CLSI guidelines, you need to prioritize the aerobic bottle because that's that's the bottle that is prioritized because aerobic organisms are the one. So that would be the bottle that you need to prioritize.
Okay.
Yeah.
Okay, any questions from the audience? If there is no question, I hope Dr. Nabil just now gave us a very good presentation. He had explained on the best practices, so I hope the things that Dr. Nabil mentioned will help us to improve our blood culture positivity rate, and on top of that, for us to reduce our contamination rate, because we want to serve the patient as good as best as possible, right?
Yes, doctor. Thanks.
Thank you very much, Dr. Nabil. I think I would like to take this opportunity also, basically to address a few of the common rejection for the blood culture and for the culture and sensitivity test encountered by the microbiology lab. Can I ask Dr. Nabil to unshare your slide?
Sure, sure.
Thank you very much.
1 second.
Mine just a little bit more things to deliver.
Okay, so I've stopped sharing.
So I'll share my screen.
And sorry, just one quick message. So I've put a link for the feedback form into the chat box. Okay, and I can also show a QR code at the end. So this is the feedback form to help me basically improve my presentation. So I've put that the link in the chat box. All right, so that's all. Thank you.
So please, audience, click in the link provided by Dr. Nabil and fill in the feedback form. So this one, other issues related to culture and sensitivity tests. For our microbe lab, this is the top 3 most common cause for rejection of CNS test requests. The first one is unsatisfactory sample. The second one is the leaking a sample container. And the third one is unsuitable sample or unsuitable container. Okay, for the unsatisfactory sample, mainly this one, majority affect this sputum specimen request for AFB smear, in which the lab will receive mostly a salivary sample, in which it is generally regarded as an unsatisfactory type of sample for the purpose of this test. Sebab it causes a very high false negative yield. And we are looking for phlegm. We are looking for phlegm, not saliva, not mucus, not a mucosalivary sample. And especially a salivary sample is not acceptable, especially for a case that you are diagnosing first time. You don't want to get a false negative results in this kind of patient. Although in our lab, we are using fluorescent staining, which slightly improve the test yield, but still it's not our way to get out of this. We still need to process a quality sample for us to get an accurate results. Okay, I requesting here for those in a clinical area, especially in medical ward, in which medical wards are among the commonest location to send this AFB test request. Pay extra attention to give a proper instruction to patient. Okay, advise patient first to relax themselves. And on top of that, it is also useful if you can ask the patient to raise their mouth first. That one is plus minus. If the patient unable to do it, it's okay. And ask the patient to cough until it is felt in their stomach. Cough very deeply and provide a phlegm rather than a saliva. And it is also an important things that the staff at the clinical area to check first whether the sample is being collected, is it a satisfactory sample or not? Because it is just something that is really a sample which is easily accessible, and you can always try to instruct the patient to provide us a proper sample. Okay, before it is being rejected by the lab. Better you ensure that everything is okay, one go at the point of care. All right, second issue is a leaking sample. Mostly this one affect the body fluid sample or bronchoalveolar lavage sample. Okay, measures that can be taken is that the container should be kept properly, and always pay attention that you need to avoid overcapping. The screw of the cap, it has a limit. Make sure not to overscrew the cap, because overscrewing the cap can lead to this leakage. It is also helpful if you can secure the cap of this container with a parafilm, and ensure most of the time that the specimen container is in an upright position if possible. Okay, this is the true examples of samples that we receive at the lab. Just imagine how can we process this kind of sample. It is very prone to contamination, and we don't want that to happen. And if the lab call you, mention that the sample we need to reject is due to leaking, just make sure that it's not that something that lab staff are making up. So it's true. We have pictures evidence for each of the rejection purpose. And then the third most common rejection is due to unsuitable container or sample. This one mostly affects samples we receive from OT. And most of the time, a large specimen is being sent in a histology container. This is not a suitable container to send for culture and sensitivity tests. You should stick to sterile container, sterile yellow cap container. Other samples such as nail, hair, a dry inanimate object for us to culture is also not adequate, because bacteria requires a moist environment for it to grow. And on top of that, tip from other than intravascular catheter tip. Lab only receive a intravascular catheter tip, not other tips such as CBD tip or PTBD tip and so on. Okay, this is the example of a sample that we receive in a histology container. This one, a very large sample. So we really need the help from the doctors in charge to sample just a tiny bit of the infected tissue, maximum 1 cm times 1 cm representative of the whole specimen, and put it in a sterile yellow cap container. You can send, if the sample is very large, you may send a multiple tissue, but each tissue needs to be labeled properly in accordance to its location and anatomical position. Okay, failure to comply may result in rejection. Okay, so any more questions before we end our session today? 5, 4, 3, 2, 1. Okay, so we are coming up to the end of our session. So if nothing else, I think that's it. We thank our Dr. Nabil for his presence today, and thank you all of you. So we see you around again, inshallah, in other CME. So Assalamualaikum warahmatullahi wabarakatuh, and we close our session with Tasbih Kafarah and Surah Al-As. Don't forget to fill your attendance and the feedback form. Thank you, everyone.